And I'd like to welcome our wonderful presenters today from our tobacco cessation and prevention programs. And I'll let you introduce yourselves and tell us about your wonderful work. Go ahead.
Well, hi everybody. My name is Christina. I'm here with Kelly. I'll start intro and then Kelly, I'll hand it off to you. Uh, we are from the State of Alaska's Tobacco Prevention and Control Program, and I'm honored to serve as the manager for that program. A lot of what we do is try to help monitor how tobacco is impacting our population and different strategies that we can do to help people who want to quit and help prevent youth from starting tobacco products. And so we take a comprehensive approach to that, but just a little structure about where we're located. We're within the State of Alaska Department of Health. And as you know, we love our divisions and our departments and our units. So it's Division of Public Health, and then it's the section of Chronic Disease Prevention and Health Promotion, and then it's the Tobacco Prevention and Control Program. And since tobacco is one of the leading causes of preventable death and illness in Alaska, we're within the Chronic Disease Prevention Program. And so really excited to be here today and to talk about specifically our quitline services available to Alaskans and what we're seeing in terms of how tobacco is impacting Alaskans with disabilities and how you can help by connecting them to treatment services through the quitline. But I'm going to hand it off to, and fun fact, I was a care coordinator many years ago, and Kara was the person who trained me. So I'm really excited to be here today and to get to work with Kara again. I know this is good company and you guys do amazing work out in the communities, and I'm just really honored to have your time today. And I'm going to hand it off to Kelly to introduce herself and her role and a little bit of what she does within our program.
Yes, good afternoon. Thank you everyone for allowing us to join in with you this afternoon. Again, my name is Kelly Jorgensen. I'm the Tribal Health Liaison within our Tobacco Prevention and Control Unit. So back in 2023, there was a project called Talking Circles Project, which was looking more closely at our quitline services and how that is received in our Alaska Native communities and populations, and how better to tailor those services to meet the needs of all of our communities, and especially in our rural communities in Alaska, because we do have a little bit more prevalence of tobacco use in those communities that are farther away from services. So we're going to touch a little bit about what we've learned in some of that today with the quitline services, and then I help out with the quitline as well and support the cessation efforts behind that as well. So happy to be here and talk more, and thanks for the opportunity.
Thanks, Kelly. So we're going to just do a tag team with Kelly and I on these slides. We'd like to keep it informal. I love getting questions in the chat, or if you want to raise your hand, Kelly's going to help monitor the chat while I speak, and then when Kelly's speaking, I'll monitor the chat. But we'd love to take questions throughout, so please do feel free to just jump in if something strikes you and you want to learn more. Okay, so today we're going to talk about tobacco use trends and resources that are available to you in your work in communities. I'm not sharing my slides, and I thought I was. So I'm going to share my slides now, so you can see our beautiful introduction slide. Which screen are you seeing? Are you seeing the presentation format, or are you seeing the one with the notes?
The presentation.
The presentation.
Perfect. My Zoom skills finally improved after 5 years from the pandemic. I knew I'd get there. Okay, so tobacco use trends and resources for care coordinators. Our goals today are to just overview how tobacco is impacting Alaskans, specifically Alaskans who report experiencing disabilities, what the quitline offers, and some ideas of ways you can help Alaskans who would like to access help quitting. A lot of the data that we're going to be presenting today is from the Behavioral Risk Factor Surveillance System. You probably hear it referred to as BRFS or BRFSS, which is a bit more of a tongue twister for me. It is a national system of health-related telephone surveys driven by the CDC. So I don't know if you've ever had a phone call from a survey company that's asking a whole lot of different health questions. That's what we do. It's a telephone-based survey. for Alaska adults 18 and older. It's done in every state. So I do say Alaska because we're going to present Alaska's findings. It was established in 1984 with some pilot states. We began collecting the survey data in 1991. Now it's in 50 states and many territories. And the important thing to know about this survey system is it's how we plan our limited resources to make the biggest impact. So if we're looking at helping Alaskans quit tobacco, we want to know who's using tobacco so that we can make sure our materials are relevant for the population. So we look at like high level population health. So we look at Alaskans as a whole, and then we look at different demographics to know who needs the resources more and how do we reach those communities and tailor our services to be relevant. So this survey is the source of many of the statistics that we'll share today. And it sounds like we might have an opportunity to come back to talk about our youth survey and some of our findings for youth in another presentation, but largely we're talking about adult statistics today. And I like this chart because this shows how far Alaska has come in reducing the impact of tobacco in our state. So as I mentioned earlier, tobacco remains a leading cause of preventable death and disease in our state. I don't know if anybody on the call remembers when the tobacco industry had been sued for producing false research and lying to the public about the health effects of tobacco. But since that time, public health programs were set up to help counteract that incorrect messaging that had been provided previously and to help provide treatment to Americans who were using tobacco products. So over time, from our first Surgeon General report to the establishment of our programs in the early 90s, we've made a lot of progress in helping get the word out about how tobacco impacts our bodies and providing free resources for people who would like to quit. We're very focused on evidence-based approaches to helping people quit. So it's very much centered on a person's desire to quit and helping people find their reason to quit. So this is very much about individualizing to where a person's at and providing resources when people are ready. And that's a really important thing to keep in mind. But the progress we've made since the early 90s is very exciting. You can see here in blue, we have Alaska adults who smoke. In yellow, we have Alaska high school students who smoke. And we do have Alaska high school students who vape, which again, I know this has been a big topic. We're going to come back and talk about vaping in a future presentation, we hope. But you can see with adults who smoke here in 1996, we were at 28%, and Alaskans have made a lot of progress in quitting, and we're down to 15%. So again, we're looking at Alaskans across the state. We did a sample of the whole population. We weighted the sample to make sure it was representative. And we have 15% now, which is huge progress. When we look at high school students who smoke, we see about 37% here in 1995, and then it came down to 7% in 2023. So tremendous progress in preventing youth from starting and helping youth quit smoking. So that is really exciting. And one of the most effective programs across the nation has been the tobacco control response to youth smoking. And then here we have Alaska high school students who vape. Some folks might have followed the vaping epidemic that we've been addressing since 2019. But you can see here we started measuring vaping among our high school students here in Alaska in 2015. And we estimate that about 18% of high school students used e-cigarettes in 2015. It skyrocketed in 2019 to about 26%. And then throughout this time, we had a very comprehensive public health response between the state of Alaska and other national organizations. The entire nation responded to this trend. And through this collective response and networked partnerships, we were excited to bring that back down to 17%. And we're hoping to bring it down even further. So we'll come back another time to talk about youth vaping, but we can see that we've made a lot of progress. So I think Alaskans should be very proud of how far we've come and helping each other improve our health. Um, I'm going to send these with Kara, so you will not have to remember these stats. There will be no quiz, but just a picture of how tobacco is impacting Alaskans in 2023. About a quarter of adults used tobacco or nicotine products. That's any type of product in 2023. And about 16% of adults in 2023 used cigarettes. We saw about 17% of adults using electronic cigarettes. 6% of adults use a smokeless tobacco product, including ICMIC. So that can be like nicotine pouches. That can be ICMIC, which is kind of more of a homemade tobacco in Western Alaska. It could be Chew, Copenhagen. So 6% use smokeless, and about half of adults who smoke tried to quit in the past year. So that's really powerful. We know that a lot of people who are smoking are trying to quit and really receptive to help. And then teens, we spoke about vaping. 17% of high school students currently vape in 2023. Saw the decline in smoking to 7%. We do see higher exposure to secondhand smoke among youth. About a quarter of high school students reported being in the same room with somebody else who smokes. So that's something we could talk more about in our next presentation. And we did see that about 1,200 students between grades 1 through 12 received tobacco-related suspensions in 2023. And that's another effort that we'll speak to, is alternative to suspension programs that we're providing. But that's a picture of how tobacco is impacting Alaskans. And as I mentioned, more than half of Alaska adults who smoke were advised to quit, and half tried to quit in the past year. So we know that people are receptive to advice to quit. They welcome it. Other surveys, people reported as encouraging, and half tried to quit in the past year. We wanted to talk a little bit about how communities experience different impacts from tobacco, and the reasons that Kelly mentioned this in her introduction. We know that some communities have a higher burden from tobacco use, and that can be for a few reasons. First, marketing is very effective, and marketing is very focused on specific populations. And tobacco is a product that is sold and marketed, and the marketing does focus on very, very specific populations. And so you may see higher rates of use within populations who have been marketed to at a higher rate. We also see varying levels of access to resources, which can be influenced by systems, policy, poverty, and discrimination. And not all communities have benefited from the tobacco control initiatives. Kelly mentioned less access to services. There may be fewer policies to support cessation in communities and to prevent secondhand smoke exposure. So before we talk about the differences in tobacco use, it's important to talk about the broader context of why why a community might smoke at higher rates than another community. So here's an example of what Kelly mentioned. You can see here our more rural regions have higher rates of tobacco use. And again, that's explained often by lack of access to services, potentially fewer policies protecting the public, or offering cessation programming. So we see here our Southwest region and our Northern region have the higher rates of tobacco or nicotine use, and then it's ordered in terms of rates down to Anchorage. Overall, about a quarter of Alaska adults use some form of tobacco. So more about our data on how tobacco has impacted people with disabilities. The BRFS, or BRFSS, whichever you prefer, measures disabilities by including 6 disability questions that are used by most federal surveys. So this isn't going to capture every disability, and it is a phone-based service. So it is something to keep in mind, is it is limited as to who it is reaching. So I just want to put that disclaimer out that it's not going to be all-encompassing, and it's not going to capture every living setting that people are in. The questions assess difficulties in 6 areas: hearing, vision, cognition, mobility, self-care, and independent living. So when we're talking about disabilities, this is how we're measuring whether or not a person is reporting a disability. And so when we look at BRFIS, nearly 1 in 3 Alaska adults reported having at least one disability from 2022 to 2023. So the data were combined to have an adequate sample to provide that number. And you can see here about 9% reported being deaf or experiencing hearing difficulties, difficulty walking or climbing upstairs, blind or serious difficulty seeing, difficulty dressing or bathing, difficulty doing errands alone, and serious difficulty concentrating, remembering, or making decisions. So this gives you a picture of how many Alaskans are experiencing these difficulties, and also gives you context when we talk about disabilities, what we mean in that context. So the next slide here, in 2021 through 2023, we have tobacco use by Alaskans who reported any type of disability. So going back to that slide, if the Alaskans responding to the survey reported any one of those disabilities, we looked at how does tobacco use impact this Alaskan. So Alaska adults who experience disabilities are more impacted by tobacco use. 33% of Alaskans who reported a disability used tobacco, any type, and 20% who did not report disability used tobacco. So you can see there's a difference between our population. So Alaskans who experience disabilities versus those who did not report a disability. We see higher rates among people who report a disability. I'm trying to go back here. There we go. And then cigarette use, when we look at smoking, so that was any tobacco product. When we look at smoking from 2021 to 2023, we see that Alaskans who experience disabilities are more impacted by cigarette use. We saw that 24% of Alaskans who reported a disability report smoking cigarettes, and 14% of Alaskans who did not report a disability reported smoking cigarettes. So we do see higher cigarette use among Alaskans who reported one of those disabilities. And Kelly was kind enough to work with our data team to pull some information on cognitive disability. So BRFIS defines a cognitive disability as adults who report difficulty concentrating, remembering, or making decisions because of a physical, mental, or emotional condition. And so 13% of Alaskan adults reported having a cognitive disability in 2024. And of Alaskans with a cognitive disability, 39% reported tobacco use of any kind in 2024. So we also see a higher impact of tobacco use in this population. So now I'm going to hand it off to Kelly to talk a little bit about the quit line.
Yeah, thanks, Christy. So our tobacco quit line, so Alaska's tobacco quit line, we're going to talk a little bit about what that is, what it looks like for somebody that wants to participate, and then how to be that conduit to help connect somebody to services that it offers. Next slide, please. So the big thing about our quit line, we're really super thankful and grateful that we're able to offer quit support services for free. So it does not cost anyone at any time to enroll into the quit line. They're there day or night, 24/7. So there's always a quit coach available to help somebody out if they're having a craving or having issues with, say, for example, they're using their NRT and have some questions. Somebody's always there to support. The supports can look like a phone call. It can be a texting option, which we'll go over a little bit later in the presentation. Or there's actually an online dashboard that participants can go into, and there's all kinds of information modules or chat functions on that as well. It's confidential, so there is a lot of stigma that happens around somebody that might be quitting or trying to quit. So this is something that a lot of folks, maybe they are not comfortable getting services where they live, especially in rural communities. So it is nice that we can offer a confidential free support guide in that way. And again, it's not only just counseling, but there's also NRT that's provided when someone enrolls in the quit line. So the NRTs, or nicotine replacement therapy, is what it's called. There's a long-term patch that typically is given to participants, as well as short-term, which is in the form of a gum or lozenge, which we'll talk about a little bit later as well. And the coach kind of helps support and decide which option the participant might want to use. And again, we have enhanced services for people that are experiencing either behavioral or mental health conditions. So that's just by means of more supports being offered and longer duration of NRT, because we do realize that there is substantially a harder or difficult time to quit if somebody is experiencing those things. Next slide, please. So the nice part about the quit line, there's multiple ways to reach out. So you can do a traditional phone call. That's a lot of our participants. That's the most common way to enroll, is by calling the quit line number. There's also text capabilities. So you can text the ready to 34191. And then there's also visiting the online portal. So you can sign up online. A lot of our providers, they'll either do the online enrollment or they actually will do a fax referral too. So if you are getting referred to the quit line from a provider or service provider, there's those two options. So it's pretty simple to get enrolled. It's just being that conduit and finding the way that works for the individual. Next slide, please. And the one thing that we like to remind individuals is that evidence show best practice is combining counseling with medication is really truly the best way to help support somebody in their quit attempt. We do know that it takes up to 7 times for an individual to quit. So definitely that's something that we like to remind our providers and our service providers, that it's not going to be one and done cold turkey most of the time. It's going to be probably multiple attempts, but the best way to support and reduce the amount of attempts is by combining the counseling with the medication. The counseling uses motivational interviewing that is found to be best evidence-based practices in helping to support an individual, as well as giving them tips on how to quit, how to negate cravings, how to do stress management techniques, which is also very important when somebody's doing a quit attempt. And then the medications, that's obviously going to help to support and reduce those cravings in the 2 ways, with the long-term acting and the short-term acting. Next slide. And then again, all these services are free. So there's also 2 special services components. We already talked a little bit about the behavioral health component. And there's also a planning to be pregnant, currently pregnant, or breastfeeding component as well. These services are tailored and they look a little bit different than our normal services. So again, the behavioral and mental health program, it helps, it's unlimited phone support. Obviously the quit line's available 24/7, but it's even more interactive. And then there's coordinated treatment with behavioral care specialists and teams, as well as there's additional stress management techniques and how to overcome cravings, as well as additional nicotine replacement therapy is offered in this program. And then for those that are pregnant, planning to be pregnant, or breastfeeding, there's additional coaches calls before, during, and after pregnancy, as well as a specialized team of coaches to help specifically with some issues that might be specific to being pregnant or afterwards or before. And then there's also coordination that happens with the treatment, especially with the NRT with the physician. Next slide, please. And then this is just an overview of what to expect when someone enrolls, because that's the big question that we always get is, what is the journey look like for somebody that calls a quit line? Because there's a lot of apprehension, about what happens, what are the next steps, do I need to prepare for anything? So we like to give information upfront of what to expect, because it can be kind of a scary and intimidating thing to call and enroll. So the first thing is to obviously get enrolled and connect, whether that be phone, text, online, through provider referral, all those sorts of ways. And then session 1 and 2 is the intake with the coach. So they sit down and talk with the quit coach, talk about some of the personal motivators that might be helping to support this quit attempt. Maybe there's some circumstances that the coach could kind of help support, as well as setting that quit date. So a lot of people think that when they call the quit line, they're just going to quit that day. but it actually is, we're going to set you up a quit date about 2 weeks ahead. Then you're going to get your NRT delivery. We're going to start using that NRT to reduce the use, and then we start our quit date. So really you're preparing for the quit date, and then the quit date starts. So that's going to be session 3. And then session 4 is right after the quit date. And then again, as long as you're going through the engagement with the coaches, by this time session 4 rolls around, you get another shipment of NRT. So that way you can prepare for the another 4 weeks that you're going to be participating in your quit. And session 5, it was a online group forum, but they've actually found it more beneficial to do the one-on-one coaching still. So then you get another one-on-one coaching session. And then at the end, you're closer to your quit, and it's working on making sure that you can maintain that behavior change. And then there's always the option you can re-enroll into the quit program. So it's not a one and done. You can enroll in the quit program as many times as needed. So that's a lot of apprehension as well, is it just going to be one time that I'm going to be able to use the program and I'm done? And that's not the case. So we just want to make sure that everybody is aware that it's always there for them to support. Next slide. And then specifically, we wanted to talk about the accessibility offerings with the quit line, because we know obviously sometimes it's harder to access services, especially if you're experiencing a disability. So the quit line, they do have some things that they offer and provide that make accessibility a little bit easier. So first and foremost, the content is written at a 5th grade reading level. So where this is mostly applied is the dashboard. If a participant logs in, there's tips, there's recommendations, there's information, and it's all at a 5th grade reading level. So it's hopefully easier to go ahead and review and then really absorb that material that's being conveyed. And then the website that is the online portal, if folks enroll in the online portion, it does meet the WCAG requirements and then the ADA Act requirements, and it supports assistive technology. So if there's certain technologies or platforms that are integrated as well, it meets those requirements to be compatible. Also, there's the TTY 711 telecommunication relay service that it's compatible as well. And then if those aren't options, the other option that someone has is to be delivering services through a proxy. So it'd be somebody that the individual who's enrolling in the program is there with and can be supported by. And the coach actually communicates and helps enroll through the program and complete the coaching calls, the session calls with that proxy. So the proxy, as long as the individual signs the consent that this is okay and that we want this person to help and support as a proxy, they can use that proxy throughout the duration of their program, or it's a year from the signing date. So if there's a quit attempt and it doesn't happen, it doesn't occur because it's hard to quit, and then somebody wants to re-engage, re-enroll, they can still use that same proxy, and they already went through the process, so they don't have to do that again. And then also there's a dedicated support channel specifically with the quit line for accessibility services. If there's issues or struggles or challenges, they're there to support in whatever ways that need to be done. And next slide, please. And then referring a client. So a lot of providers, they do refer clients. There's either a fax form or there's the online portal. I'll go ahead and put in the chat the online portal. It's not just for physicians. Anyone can enroll. So the participant, if they want to enroll in the online portal, they can do it. The proxy can start the online enrollment portion and then connect with the coach to fill out the proxy information. So that's a quick way to get enrolled if the phone call or text options are not convenient. And then again, the biggest thing is just filling out all the information, making sure if it is a provider that they have an MPI number and then that they post that so they can see the outcome report and they can help coordinate care afterwards or duration of their quit attempt. Next slide, please. And then as Christy had mentioned in the beginning of the presentation, advisement to quit from a service provider, a physician, a nurse, home health care, anybody that's involved, the more advisement to quit, the more chances and the more prevalence that there is going to be a successful quit attempt. Even if it's not the first time, the more it's introduced, the idea and the support, the better the outcomes. So we like to provide free trainings to help support this. So the brief tobacco intervention training we offer, it's about 45 minutes to an hour long training. It goes through modules and simulations so you can see what those conversations and brief interventions look like, how you can facilitate those conversations, maybe with somebody that you're working with, and then how to best connect and support the person to services. And then there are CEUs that are available with taking that training. So it's with NADAC and then the American Academy of Family Pediatrics. So taking this class will actually fulfill CEU requirements through those accrediting agencies. The other training that we do offer is the addressing nicotine addiction in Alaska behavioral health care. So this is a little bit more on the behavioral health side of things. It goes a little bit more into what specifically addiction looks like, especially in tobacco use, and then how to support patients in that. And I will actually drop the training link for that one as well. So you can go to our website and then look at the resources, and the links are right below for the education opportunities. And again, these are free services, so you can take them at any time. There's no requirement to take these. Next slide, please. And then we just want to go over a little bit of the print materials. So we do have a lot of resources within our offices that we've created to help support and give information pertaining to using the quit line or educational information to better help support awareness and education on why we look at preventative measures for tobacco use. Next slide, please. And this is just an example of a rack card that we have. So as you can see, it's front to back. It gives a little bit of what to expect when calling the quit line, which is helpful. And then it gives a little bit more information surrounding awareness and education and why it's important to look at quitting tobacco or nicotine products. And then it also has contact methods for the quit line. And then we'll go through a couple more slides that gives a little bit more examples of some of the materials that we have. And then these are our newest additions to our materials, printed materials. So with the Talking Circles project, we use that project and the qualitative analysis and data that we received to tailor these products and these quit line cards. They give information that are more relevant to our rural Alaskan Native communities and populations. So we're really honored and privileged to be able to use this project to help tailor and support this for our communities, making sure that we have outreach that helps, especially our communities that are experience more of a tobacco disparity. And next slide, please. And then this is also some more newer materials that we have. The parenthood posters. This is great. It's like a 8x12 poster, I believe, are the measurements. These are great for like clinic spaces, waiting rooms, those sorts of things. Gives, again, some more education and awareness on different tobacco and nicotine products and the effects. And then it also has resources on how to quit. And then, yep. And there's two more examples of the parenthood posters. Perfect. And then I'm going to actually grab a link, another link for you all the links today. So this is a good library onto our website. And if you go into the link, you can look and see it's shared and distributed for who the audience is that's looking for resources. So we have adults, we have Alaska Native adults, mental health conditions, schools, youth, healthcare providers. We have sort of different informational toolkits, posters, rack cards, all kinds of things. So if there's something that you think would be helpful in your practices and who you service and provide services for, let us know. We'd be more than happy to help you. But definitely you can feel free to check out the link and browse and see what we have available. And we mail these things out free of cost. So just let us know what would be helpful, and we'd be more than happy to get that off to you. And that's at least our presentation. And I know the last slide had some contact information. If you want to contact the TPC team, that's a good way to get a hold of us. And I will go ahead and pause. And it looks like we had quite a few questions in the chat.
Yeah,
so we'll start kind of going through.
Yeah, Kim had a really great question about do we gather information or provide resources for those who use both tobacco and alcohol? My experience is that the two often go hand in hand, and we do see higher rates of tobacco use with substance use. And we also see that, particularly with marijuana, we see lower success in quitting if somebody's using multiple substances, which may be just an indicator of a higher level of addiction. So we do offer an enhanced program, which includes services for people who have a substance use disorder. We also, and that's just like Kelly mentioned, the longer duration of services, a longer duration of NRT, as it may take that person a longer time to quit. We also partner really closely with our Division of Behavioral Health to promote the quit line within the substance use treatment centers as well. And then for folks who are maybe trying to quit and use alcohol, but maybe don't have the substance use disorder component, the quit line can help walk people through, like, what are the things that trigger tobacco use, which sitting down with a bourbon and a cigarette might be something that's a routine for somebody. Even coffee and smoking together could be a routine. They talk about eliminating those routines and switching it up with a new routine to prevent a trigger. Kelly, there was one question that I wasn't able to answer. I can't recall whether there's a cap on the number of times a person receives nicotine replacement therapy in 1 year. I know that enrollments are unlimited, but could you remind us on whether NRT is limited?
Yeah, I think as long as the participant is actively engaging with a coach, the time that they would stop sending NRT is when a participant does not engage with the coach and do the counseling portion of it. So as long as there's active engagement with the coach, especially if we need longer duration than the 8 weeks of NRT, we need to re-enroll in the program, they will help to re-enroll. So as long as there's engagement with the coach, the NRT can continue.
And a person can enroll as many times as they would like to enroll in the quit line. So there's no limit on, like, I think it takes on average 30 quit attempts before somebody's successful. And the quit line, it understands that. And so people enroll multiple times. And in fact, at the end of the year, we go back and do re-enrollment calls where folks who maybe dropped off, like Kelly was mentioning, get a call to ask whether they'd like to try to re-enroll in the program. We had a really good question here, and we might need to get back to the group, but Kelly, you may also have context from Lori's work with DOC, but there was a question about whether the quit line have counseling programs or partnership with Alaska DOC when individuals are incarcerated and don't have access to a phone to communicate with the quit line. I know this is an area we're exploring. Kelly, I don't know if you have a current status on that project.
Yeah, we're definitely in talks with some of the individuals in DOC that work, especially the difficulty is the NRT. We're not able to provide NRT when somebody is actually incarcerated. So that becomes the problem. We see that it's more effective if we have NRT plus counseling. That's probably a good question that we could ask further with DOC if somebody's just able to access just the phone communication. That would be up to DOC at that point. But the issue would be that we wouldn't be able to provide the NRT. But the counseling, they don't have to provide NRT. They can still do the counseling portion. But we have explored, especially when somebody is actually released from incarceration, that's kind of where we're focusing a little bit more because then we can coordinate NRT with the counseling, which is best practice that helps support that quit. But that's a great question.
We also had a question on whether we survey end of life use, whether people tend to use more or finally quit when they learn that they have a terminal condition. That's a really good question, Kim. And I think I'm gonna have to go back to our epidemiologist and ask whether that's something we can pull out of these data. But we do see that at different stages in a person's life, motivation changes, and often changes in health can motivate change in lifestyle. So one example we have is pregnancy. We see among Alaskans who are planning to become pregnant, or even after pregnancy, we see significant reductions in tobacco use. So it's a very motivational time to quit. And so I could look into this. I suspect that you're probably onto something, that a big life event like that could spark changes in lifestyle. But I would have to ask our epidemiologist and get back to you through Kara and Kat.
And then the only other question I see is from Kim, which Christy, you kind of touched base already. That specifically we'd have to look with anxiety disorder and get with our evaluator. But typically, those who have mental distress frequently do have a higher prevalence of tobacco use, unfortunately. So that is known for sure.
And that has a long history too. When commercial tobacco was mass produced early in the 19th century, we saw quite a few messages that were repeated by the industry, with doctors, prescribing cigarettes and recommending cigarettes as a way to de-stress and unwind. So there's a very long-standing association between cigarettes and stress. A lot of that, again, like when we talk about differences that communities experience, that's a really good example of why somebody who experiences anxiety might try cigarettes. There's just a lot out there which tells folks that, hey, this is a way to manage stress. And it does give a temporary mood boost. But as your brain withdraws from nicotine, it can actually make anxiety worse. So there's some intentional marketing around that space that could also be driving that correlation.
These are great questions. Thank you so much for posing all these.
And this has been a great presentation. This is Kara. We have about 10 minutes left in our session. What are your thoughts and questions for our wonderful team here? I know you done a lot of hard work, and we're certainly impressed. Any questions for? Go ahead. Yeah.
Are we allowed to ask questions of the group?
Of course. Yeah. Two-way street.
I'd be interested to know, like, what were your thoughts around the fax referral and web referral process? Does that seem like it would be something that fits within your workflow? Or like where do you see this topic coming up in the work that you do? I would just be really curious, like your initial thoughts when you see the ways people can connect. And then in context of the important work you do, where might the connection be, do you think?
Go ahead, care coordinators. You can unmute and answer. Go for it.
I will say that this is Nishama. I can appreciate the fact that there's many avenues to get resources available, because before it was more like there's only one stream of accessibility, and now this accessibility is becoming more flexible, more convenient. For people who tend to be shy, I think having to do it in your own time, your own space is also very useful. And the fact that there is timeliness, you don't have to wait until the next morning to speak to a case manager. Like that, I think the accessibility is definitely a plus.
Hi, this is Jimmy, care coordinator. I have a client at assisted living with an intellectual disability who's wanting to quit smoking due to a heart condition. And he recently asked for nicotine patches. And I think he would be willing to do counseling, maybe if I or someone else sat in with him because he's very shy and unsure of himself. So I could see maybe this working for him, with assistance.
Yeah, that's great. That would definitely be where our proxy comes in. So definitely able to utilize those services with the proxy. So depending on how you enroll, if you communicate online or text or call, just let the coach know that you want to participate in the program with the proxy, and then they should be able to get you set up from there.
I'll definitely look into doing that for him. Thank you.
Yeah, thank you.
There might be some questions about his underlying heart condition as well. So the proxy might want to have some information about that available. The reason being, nicotine replacement therapy still contains nicotine. So there are some conditions where they might ask for a doctor to weigh in on the safety of nicotine replacement therapy. So with it being a heart condition, the proxy might just want to have that information on hand to be able to answer questions if requesting NRT from the quit line, just to make sure that what is being sent out is safe for that person.
Yes, I already asked for the doctor to write that script, so we'll see what he comes up with. But thank you for that.
Yeah, and I guess one other thing I did forget to mention, that is part of the call. So when you intake with a coach, they will ask about current tobacco or nicotine use. And the reason for the ask is to help put a patient on the right dosing of NRT, because there's different levels depending on how long an individual has used nicotine products and how frequently. So definitely, if somebody calls to enroll in, maybe having that information available too, because that'll help support the most effective use of the NRT product too.
Other thoughts? Thinking about the people you serve, individuals and families, and how they might use these options?
And pretty quickly, guys, if is it okay that we share your email addresses with the folks? It's in the presentation, but if maybe your coordinators think of some questions or some scenarios for you later on, can they reach out to you directly with some questions and talking through. You guys talked about this a little bit, but this is not Medicaid related, right? This program is not billing Medicaid or anything like that, so it doesn't affect anybody's waiver. So it doesn't have to be on a waiver to qualify or benefit, right? It's really free for anyone and anybody and everyone who is interested. So.
Yeah, that's a great point, Kat. The history behind that is, I think in the beginning we mentioned that a lot of work was done to counteract misinformation from the industry. Part of that included a lawsuit against the big tobacco companies, which were hiding their research, which showed that smoking caused cancer. And as a result, states entered a shared agreement with the tobacco industry, and they pay an ongoing settlement to states through that agreement. And so our program and the Quit Line is funded through that lawsuit money. We receive a small portion of it. Quite a bit of that goes into school bonds. And then also funded through cigarette taxes, again, a small portion of the cigarette tax. So it's not tied to Medicaid. And we don't bill insurance and we don't bill Medicaid. Medicaid works with us to help with our costs so that we can offer this free service, but it's not dependent on a person's eligibility at all. But I missed the first part of what you were asking, Kat. So I wondered, was there a question? And maybe Kelly heard it, but my speakers just weren't working.
Oh,
real
sorry.
well for
I'm
the
just
first.
asking for if you could put your email addresses in the chat, maybe. I know they're in the presentation and we're going to share the PowerPoint with care coordinators, but just really quickly so that folks can grab them if they have some immediate burning questions, tonight or before we email out the presentation to them. Or, they have scenarios and there's, I think, one more question in the chat now from Kim again. But
Yeah.
just then they can reach out to you directly if they have questions.
Yeah, definitely. And Kim, I think those trainings that Kelly highlighted would be excellent to take. A lot of what we do is around motivational interviewing. So it's about helping people find their reason to quit. And it might take multiple conversations, but if you use an evidence-based approach through motivational interviewing, it's very much tailoring to where the person's at and helping them find that reason to quit. So that might be helpful in having those conversations. A lot of the research shows that brief intervention is very effective as well. And then the right to smoke or use alcohol. I know resident rights come up quite a bit. So I think it's important that we frame this around the benefits of quitting. And we can send another link about here's how your body is going to feel better the moment you quit. There are instant benefits to quitting, and people find that quite compelling. Most people who smoke do want to quit. They might not be in that spot at that moment, but there's a high desire to quit. So it's about helping people think about the benefits of quitting. Another effective strategy is we have cost calculators. Once people see how much smoking costs per year and what they could buy with that money, that can also be really motivating. But it's again continuing to find those motivators and provide encouragement, and that training can offer some helpful ideas. So I do recommend that training that Kelly put in the chat for sure. But that can be a challenge, and just continuing to have supportive conversations to help people find their reason to quit is a really great approach.
And again, if there's resources or information that we can provide that help assist, whether that be benefits or statistics or anything, feel free to reach out to our team and we can provide you what we can to support that.
Well, thanks everybody for those amazing questions. I think we have a lot of ideas of additional resources. So Kat and Kara will probably put together a packet if that's okay.
Oh, that'd be great. I think that'd be great.
Yeah.
Interpreters usually like to have things to take back and share with other folks. We share those around. So good.
And what we can do is put it in our resource document library inside our Learning Academy. So if you attended today, we can send you the PowerPoint, of course, and the links and things like that were shared. But we can also put that in there. So, if somebody didn't attend today and they wanted the info, it would be there or you yourself could go find it there as long as you're in the Learning Academy as a care coordinator. So, yeah, I appreciate that. Well, this has been a wonderful presentation. I certainly learned a lot. Thank you again for coming and speaking, and we look forward to learning again from you at some point. We know there's more to the conversation around tobacco cessation and prevention program. And our audience is very engaged and says thank you. So it's been great. All right, and this concludes our last Care Coordinator Info Share of the year. We'll communicate to you about the Info Share series for 2026, but thank you for helping us land on a wonderful, healthy note. And I wish you have a great rest of the week and, of course, happy holidays. We'll go ahead and close the session.